Hi, this is Jennifer Coluciello, and we will be talking about kidney disease education. As you know, the United States is experiencing a significant increase in the prevalence of CKD. Considering the high associated cost of care and the significant accompanying health risks, kidney disease education would be highly beneficial for the patient and the community, as well as local and national healthcare costs. This KDE program will take a short approach to reaching the patient where they are, giving them back control of their disease, and thereby achieving a slowed progression of the disease and an increase in quality metrics. Our program will target your patients who have CKD stages 1 through 5. The goal and focus of the education is to help them understand their disease, identify and manage risk factors within their control, and learn to slow the progression of the disease, as well as think ahead to the types of dialysis if their disease does progress to ESRD. While the education itself will cover a wide breadth of information, it will be limited in depth. This will allow for keeping the content of information at a level that a lay person can easily understand and apply to their everyday life. The goals of the program are to increase patient compliance with follow-up, treatment, and mitigation directives, increase patient outcomes, and decrease or slow their progression to ESRD. The education itself will be divided into 3 distinct sessions, one weekly for 3 weeks. This will avoid overwhelming the patient and allow them time to filter and absorb what they have learned from each session. Breaking this into these 3 sections will make it easier to assimilate and allow for increased interaction after the patient has discussed with their family and friends. These sessions can actually be done in person or virtually via an audio-visual platform, and they can be done individually or in a group setting. Week 1 will focus on the disease itself, covering normal function, impact of CKD on that normal function, risk factors, testing, signs and symptoms, and consequences if untreated. Week 2 will look at how to protect the kidney, including lifestyle changes, medical treatments, support groups, and other resources. Week 3 will be dedicated to reviewing dialysis modalities, process and risks, and transplant options. All information covered will be given in printed form for the patient to be able to take notes and reference after the educational session. These printed materials will also involve interactive workbook pages to further enhance the patient's involvement in the treatment process, including a blood pressure log, medication log, weight log, and lab value trending. The progression and process is actually pretty straightforward. Once the practice determines what those scheduling options, dates and times, group versus individual, etc. will be, each physician will identify appropriate patients for the KDE. The staff can then schedule those patients and give them the flyer for the program. The educator will perform the session and then submit attendance verification to billing and a note about the education back to the physician to ensure that everyone is on the same page. While not the primary goal of the KDE, we must keep in mind that if we're not successful in the business of medicine, then we will not be able to practice medicine. As such, there is a financial consideration to offering this to patients. KDE has been deemed highly beneficial by CMS and is identified as a reimbursable service. The code G0420 can be billed for face-to-face sessions of 1 hour per session per individual. This carries a reimbursement in your MAC location of $112.06. The code G0421 can be billed for face-to-face educational sessions of 1 hour per session for attendees in a group session up to a total number of 26 people. This reimbursement for your MAC is $28.03. While these numbers are not significantly high, they do allow for covering the cost of providing the education with some additional financial benefit for the patient without taking physician time. Based on the MAC reimbursement levels for your region, if you do 3 sessions for 100 patients individually over the course of a single year, there's a potential reimbursement of over $33,000. Keep in mind that the overhead should be considered when looking at the potential revenue benefits for your practice. In addition to those immediate financial benefits, there's also a downstream impact to your overall quality metrics for the practice, which can then have impact on your financial incentives or penalties from CMS. Many of these value-based care initiatives and quality metrics include patient outcomes. While that's fine for a service that does not rely on patient compliance with treatment or therapy, when all is said and done, we cannot force a patient to follow direction. This can negatively contribute to the patient outcome, which can adversely affect your future reimbursement levels under MIPS and MACRA. KDE will actually help increase that patient compliance, thereby increasing your patient outcomes as well as these kidney-related metrics. Participation in some of these programs with the KDE may actually qualify you for participation in an advanced alternative payment model, an AAPM, under the MIPS and MACRA concept, which then carries an exemption to the MIPS attestation requirements. As we do this, by taking this proactive education approach, we hope to accomplish several different things. This approach will allow the patients to easily understand the information and apply it to their everyday life, making it relatable, applicable, and most importantly, actionable for them. This actionable information will give the patient back some control of their disease. This works to empower the patient. By giving the patient education about what is involved in this process, all types, especially when it comes to the dialysis treatments, the impact on the life that can have, this will actually motivate the patient to be vigilant and compliant with care plans now to hopefully prolong their time before they have the need for dialysis. This increased motivation to avoid dialysis, along with the tools needed to do so, will subsequently lead to better clinical outcomes for the patients and an increase in a shared decision-making process. As with anything in healthcare, we want to assess effectiveness for our KDE. We will do this by measuring 4 main items. The first will be compliance with their follow-up visits. The second will be by tracking compliance with personal blood pressure monitoring. The third item will be by looking at trends for pertinent lab values, and we will also look to see stability, slowed negative progression of those values. The fourth item will be the time of progression to ESRD, specifically looking here for an increase in time interval between progression through the CKD stages. With all of the above listed benefits to all involved, but primarily to the patient, and no uncovered cost to the practice, offering this education to the patients truly has no downside.